Good morning. Is the mic okay? Sound okay back there for everybody? Wonderful. Welcome. This is the third workshop of the Institute of Medicine Global Forum on Innovations in Health Professional Education. I want to welcome the forum members back from your hard day's work yesterday, to all of our guests and speakers who are here, to our guests who are in another room watching right now, and also this is being broadcast by webinar, so that we want to welcome everybody from webinar land to this particular workshop. Our topic today is establishing transdisciplinary professionalism for health. And I think this is a topic that is really going to promote some thoughtful discussion and to stretch our thinking a little bit. As a psychologist, my interest in professionalism is not just because we need to train future psychologists to be professionals and to act professionally, but also because professionalism really is a set of beliefs and feelings and behaviors, which is the substance of the subject matter for my discipline itself. So it is really exciting to be able to do this morning. I would like to start by introducing my co-chair, Dr. Matt Winia, who will be speaking to you later. He's the Director of Institute for Ethics at the AMA, and he challenged us all to transcend our current thinking and planning for this workshop. So thank you for your collegial and intellectual contributions and support. I'd also like to introduce the members of the Planning Committee. That is Liza Goldblatt, Nancy Hanrahan, Sandeep Kishore, Sally Oken, Rick Talbot, Richard Vlachovic, there you are. All of you who have been great contributors to having pulled this workshop together. We certainly have been through a process in our own thinking about this that has evolved over time. I also want to thank the staff of the Institute of Medicine. I think it is an understatement to say that we would not be here if it weren't for Patricia Cuff. Patricia has been the linchpin for this whole event, and really her expertise and her commitment has made this happen. She's been aided by an able staff, Megan Perez, Rachel Taylor, and their director, Patrick Kelly, who've really been fronting for this effort for quite some time. I also want to acknowledge the co-chairs of the Global Forum itself, Afaf Malis, who could not be here today, but Jordan Cohen, who is a co-chair and actually who is a scholar in the area of professionalism himself. I also want to introduce in the corner over there, Amber Shiflett and Hunter Clary of my staff at the American Psychological Association, and they're going to help us manage the clicker system. It's an audience response system that we often just call clickers. So I would like you to take a look at the one at your place right now. You will see on the front of the clicker that there are a series of numbers, and this is really easy. All you have to do is press the number of the response that shows on the screen that you want to choose in making your entry into the response system. And how will you know that you recorded that response? Well, turn your clicker over and look on the back. And that's who you are. That's your number. Now, we have not recorded these numbers, so all of your clicker responses will be anonymous. There's no hidden code, definitely anonymous. But let's try it to see how it works, okay? What is your favorite color? No, you actually don't have to hit send. Is everybody's working? We have others. If they're... You're right. It's no longer up there. Your number goes away. Your number goes away when you press the button. So who's having difficulty? Anybody having difficulty? Everybody's voted? All right, let's see the results. Look at that distribution. That's very interesting. All right. So blue is in green. This is a Stroop test, if you know about psychology. Psychology? No. Uh-huh. But we have more people that like blue than red or green. But we also have a number of people that like none of the above. These are the people maybe that like things blended, that take the primary colors and put it together. And that's exactly what I was going to say next, Jordan. You're absolutely right, because you could also say, well, that was a dumb question. That question wouldn't be appropriate for somebody who was colorblind. And so the purpose of these systems is not to get the right answer, it's to provoke discussion. And so when we use this, you may challenge the question. You might say, well, if it would word it this way, I would think something else. And the whole idea is to promote discussion. It is not voting. Okay, let's try one more question. Which Institute of Medicine report highlighted the need for professionalism in healthcare? To err is human, crossing the quality chasm, health professions education, the bridge to quality, only B and C, all of the above. Uh-oh, 5 is covered. Yeah, sorry about that. Yeah, so just go with the first one, Sam. Forget 5. Yes, you can revote. Yes, push again. Change your mind, push again. 5 is all of the above. Everybody voted that wanted to vote? Early and often, remember? Okay. Hunter? Aha. All of the above. Excellent. Although Patricia actually did a search of all the documents and found the word professionalism only once, I think, in all of those documents. And so, but the concepts and the concepts that we're going to talk about today are throughout each of these documents. Isn't safety about our social contract with society, about providing quality care, et cetera, et cetera? So you can use the kind of clicker system to promote discussion and understanding of things and that kind of thing. Okay, so returning to our topic, let's get into some definitions. What is transdisciplinary professionalism? Well, we've defined it as an approach to creating and carrying out a shared social contract that ensures multiple health disciplines working in concert are worthy of the trust of patients and the public. Now, let's say a little bit more about some of the terminology that we've been using. I'm going to review this in a very broad brush kind of way. I'm not going to get into the nuances in the literature and people argue about different words. I'm just going to try to promote a shared understanding of how we're using language for this workshop. There's been considerable emphasis in higher education on the relationships among disciplines and how to create new knowledge that actually contributes to solving challenges of society. And in fact, as Brewer noted, the world has problems, but universities have departments. And do we have that same counterpart in healthcare? Patients in their communities have health problems, and healthcare has licensing boards. So there are very different ways in which disciplines can work together to address problems, and some approaches are probably better for some kinds of issues than others. So let's just review some terminology. First, we have unidisciplinary, those from a single discipline working together to address a common problem. That's the way actually a lot of things are done in fields. Then there's multidisciplinary, those from different disciplines work independently, each from a discipline-specific perspective with the goal of eventually combining efforts to address a common problem. In practice, this is the kind of parallel play you often see with respect to a lot of outpatient care. Different people see it, and then hopefully at the end they combine and come up to a solution. Interdisciplinary is an interactive process where people work jointly, each from a discipline-specific perspective to address a common problem. And so this is very common in rehabilitation, specialized teams such as burn units, ICU units, organ transplant teams. and increasingly common in primary care. And certainly, I think something that this group, particularly this forum, is very committed to. So transdisciplinary is an integrative process in which there's a synthesis and extension of discipline-specific theories, concepts, and methods to really create a new model and language to address common problems. In practice, that's often referred to as actually a blurring of the disciplinary boundaries, crossing over of roles and functions. There's also, in the literature, different usages of the term interdisciplinary and interprofessional. When we talk about issues in health, education, and practice, we often use the word profession. And why is that? For maybe a couple of reasons. Not all health professions are actually academic disciplines. And in preparing for this, I read some articles where some professions were arguing they are not a discipline, they're a profession. And another reason is that some health professions call their different practice specialties disciplines themselves. The words profession and discipline really do not have consistent usage in the literature, and we're not going to settle those issues here. But we did find the term interprofessional is used more often than interdisciplinary in describing the interactive team process in patient-centered collaborative care. So that's the one that we're going to tend to use to reflect that concept. And some believe that actually interprofessional conveys more depth of mutual involvement across the professions than the word interdisciplinary. Yet it could exclude members of a healthcare team who are not labeled as professionals. Nevertheless, this forum is focused on health professionals' education, so we think it'll suffice. So interprofessional practice, then, the current terminology for two or more professions working together as a team with a common purpose, etc. You know this one well. Another core concept to our discussion today is that of professionalism. It is a concept that is really fundamental to all professions, although the standards for professionalism are usually decided in the silos of the various professions. Definitions of it abound, and they include characteristics such as altruism, integrity, do no harm, beneficence, and professionalism also serves as the basis for the profession's relationship with society, often referred to as a social compact or the social contract. The profession actually professes to the public that it will be altruistic, self-regulating, trustworthy, and address societal concerns in return for its autonomy, prestige, and the public trust. And as Dr. Winia has noted, professionalism transcends a list of desired behaviors and codes of ethics. It is really the reason for creating such lists and acting in accordance with them. It is a belief system and ideology. So here's my attempt at a few graphics that perhaps by the end of this workshop, you all will completely change and evolve. Professionalism is professed by many separate health professions, all of whom see themselves, and there's a large literature on this, having a contract with society, a social contract with society. With the increased focus on collaborative care in efforts to reduce error and improve quality, there's also occurred an increased need to examine the linkages across those professions and how to build bridges across those professions. So rather than conceptualizing professionalism within the silos of the profession, efforts have been made to articulate elements of professionalism that are uniquely relevant to collaboration across the professions. And that is what we refer to as interprofessional professionalism, a core definition that you will also be hearing more about this morning. So, interprofessional professionalism, the next graphic, really underscores the fact that cooperation and communication is critical across professional boundaries in multiple directions. Its proponents warn that with the increased complexity of care, siloed approaches to professionalism may actually undermine safety and quality as well as patient, family, community-centeredness. And you'll hear more about that this morning too. Our question is here in this workshop, if we ever even get to well-developed interprofessional professionalism? Will it lead to a transdisciplinary professionalism? And in the next slide, as you can see, the transdisciplinary professionalism leads to a shared social contract, which is shared by all of the, next slide, please, which is shared by all of the professions by a unifying set of beliefs and behaviors that they profess to the public. Will the multiple health professionals be able to work together to create such a shared contract with the public that is worthy of the trust of patients and the public? Transdisciplinary professionalism is not the same as transdisciplinary practice. Remember, practice would be the blurring of boundaries with respect to skills, competencies, practice in the trenches. This is the shared contract, the blurring of the boundaries and the creating something new with respect to an ideology, with a set of beliefs, where health professionals take on aspects of the transcendent ideology across all. And then if we did that, what would that mean for the education of future health professionals? So that's what you're here to discuss today. This morning, you're going to focus on the building blocks for future discussion. We will examine the concepts of professionalism and interprofessional professionalism, and then through small table discussions, address our understanding of transdisciplinary professionalism. This afternoon, we'll begin with breakout groups focusing on some different aspects of that, and then examine the social contract for health professions, education, and practice. Tomorrow, we will also examine some very specific on-the-boots ground methods for teaching professionalism and conclude with reflections on our conversations to date. We may well, in this workshop, raise more questions than we answer, and that's really okay with the planning committee. We are not forcing a solution to this or to a particular place, but we want to challenge our thinking about it. We may only take initial step, but I think it is important to ask, will we be able to develop as health professions a shared social contract with society? And to also then, how would we model that and how would we teach that? Where we go, and we haven't been there before in this kind of forum, will depend on your views and your own perspectives on that you will bring to this. And like I said, the graphs may be totally remodified. We also want to note that our presenters for this conference are really very notable people who have tremendous number of achievements in their own field, and so their introductions will be extraordinarily brief. You have the materials in your packages that describe more of their background and expertise. And so in that vein, I would like to welcome our first speaker, Dr. Fred Hafferty, the Scholar of Professionalism and the Associate Director of the Program for Professionalism and Ethics at the Mayo Clinic. Welcome, Dr. Hafferty.